Hi. You're invited to People Hub. We'll discuss progressive prostate cancer screening in this video. We therefore looked into this topic further today and we'll be talking about it. The conclusion of this film will without a doubt astound you, so be sure to watch it all the way through. Let's begin straight away. Please click the subscribe button before we begin if you want to see more films like this one in the future. Although there is no known cause for prostate cancer, it is more common in older men, and the number of people with the disease is rising as the population ages and health screenings are made more widely available. The fourth most common cancer in men and the seventh overall is prostate cancer. The fact that it is the only male cancer to exhibit an upward trend and that its rate of incidence growth is by far the highest among male malignancies is notable. Early signs of prostate cancer are rare, and symptoms like hematuria, frequent urination, and difficulty peeing only arise once the cancer has advanced or is coupled with hypertrophy. Only around a third of men with prostate cancer are found to be symptomatic, and 2/3 do not exhibit any symptoms when they are diagnosed. Is significant. Men over 50 are advised to receive a prostate cancer screening once a year, and men with a family history of the disease are advised to start having annual screenings in their mid-40s. Regular follow-up exams should be carried out to prevent recurrence or metastasis, and follow-up exams should be carried out at 3 months, 6 months, and 12 months in the first year following surgery. This is true even if cancer is discovered early and the proper treatment is administered. It is advised to get checked out every 6 months for the next 3 years and then once a year after that. A blood PSA level test is one of the screening procedures for prostate cancer, prostate-specific antigen test. The enzyme known as PSA, which is exclusively found in the prostate in human bodies, is produced by prostate epithelial cells. Therefore, a high PSA level in the blood indicates the presence of benign prostatic hyperplasia or prostate cancer. Is employed as a key marker for. It is advised that persons in their 40s or older, or those in their 50s or older if there are no risk factors, undergo a PSA test every 2 years if there are any risk factors, such as a family history of prostate cancer or obesity. You should get checked every year if your PSA level is within the normal range but on the high side. Prostate cancer cases are significantly rising in Korea as a result of the country's aging population, and more people are calling for the PSA test, prostate-specific antigen test, to be incorporated into the country's national cancer screening program for early diagnosis. Prostate cancer can be found with a digital rectal examination, in which a physician places a gloved finger into the anus and touches the prostate gland. You can feel a hard nodule on your prostate if you have prostate cancer, but it is challenging to diagnose cancer that develops in the prostate center, which is difficult to touch with your fingers and is smaller than 0.5 milliliter. Transrectal ultrasonography is useful in this situation. When a hard nodule can be felt when the prostate is touched or when the blood PSA level is 2.5 to 3 nanograms/ml or above, a biopsy is carried out. The prostate and rectum are in close proximity, thus an ultrasound probe is put into the rectum and the prostate is punctured while the patient watches the ultrasound imaging. 10 to 15 minutes are allotted for the examination. Patients frequently feel uncomfortable or burdened during the examination, such as moving during the examination, as a result of the brief pain that occurs as the needle goes through the prostate for tissue detection. Additionally, prostate biopsy often entails puncturing 12 prostate glands in order to obtain tissue, but this has the drawback that the accuracy of the biopsy is less than 50% because ultrasound cannot entirely identify prostate cancer from normal prostate tissue. Due to this, a repeat biopsy should be done 3 to 6 months following the initial biopsy, even if malignancy was not found. Prostate biopsies have recently been performed utilizing 3D MRI ultrasound fusion imaging technology that integrates transrectal prostate ultrasound pictures with prostate magnetic resonance imaging, MRI, in real time to create a three-dimensional image, in an effort to boost the accuracy of the procedures. A magnetic resonance scan, MRI, which can more precisely pinpoint the probable cancer spot, and an ultrasound image, which displays the location of the needle insertion in real time, are added to this approach of performing a biopsy while seeing a 3D fusion image. The average diagnostic rate of this test method is 71.4%, which is more than twice as accurate as the current test method, 25 to 35%, according to a study by a university hospital, raising hopes for a precise diagnosis. Early-stage prostate cancer carries a low risk, and death from the disease is unlikely to occur within 10 years after diagnosis. In order to monitor their state through waiting observation therapy, elderly patients or patients with a low or local risk of cancer progression receive periodic examinations. The prostate will be surgically removed if the patient has no underlying diseases and has a survival time of more than 10 years. Open, Laparoscopic and robotic surgical techniques are available. Robotic surgery has recently become popular in Korea and is currently being used there. Robotic surgery provides a quick recovery time after an operation, and it performs better than open surgery in terms of the common side effects of erectile dysfunction and urinary incontinence. These benefits increase patient satisfaction. Radiation therapy or hormone therapy may also be used alone or in conjunction with other treatments, depending on the patient's condition. If you like this video, don't forget hit that like button, and subscribe to this channel for more videos like this in the future. Also, be sure to turn on the bell notification so you never miss any of our videos. So, what do you think about this topic? Let us know what you think in the comment section down below. If you enjoyed this video, the next one will be fun. See you in the next video. Thanks for watching.